Call to order Health, Education, and Welfare Committee agenda, August 11th, 2021. The time is now 2:04 p.m. I'd like to ask Representative Marshall to please give the invocation.
Creator God, we just come at this time and we just ask for your continued guidance and your wisdom and your knowledge that we can go about doing the business that's set before us. And we just ask that you continue to lead and guide this nation and bless all those who are here today and bless those who are not able to be here with us today. And we just ask all these things in your name. Amen.
Roll call, April Lindsay.
Mary Crawford.
Present.
Joyce Deere.
Present.
James Jennings. Here. Anna Marshall.
Present.
Lucian Tiger.
Present.
Chairman, you got 5 present and 0 absent.
5 present, 0 absent constitutes a quorum. All business conducted to be official. Next item on the agenda will be the approval of minutes, 7/14/21. Representative Marshall made a motion to approve the minutes with any necessary changes, seconded by Representative Crawford. Discussion. Any discussion? Hearing none, roll call vote, please.
Anna Marshall.
Yes.
Mary Crawford.
Yes.
Joyce Deere. James Jennings.
Yes.
Chairman, you got 4 in favor and 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda will be the order of business. Rural Fire Department applications, Cromwell Volunteer Fire Department.
No, it's the one that says Austin.
Austin?
Yes, sir. Thank you, Council, for having me today. Yeah, we are applying for the grant. As you can see from the quotes that I provided, that we are very behind on a lot of our equipment, outdated, and what we actually just need. We're looking to actually get another truck in full operation for the fire season for our whole region and actually Seminole County, because we help out a lot of Seminole County as well as of Fusky County. Anything would be greatly appreciated from the council. If you guys have any questions for me, I'd be more than happy to answer.
Thank you, Austin. Questions from the committee? Representative Marshall?
Austin, are you going to be doing any fundraising on your own to raise the?
Yes, ma'am. Actually, we have been doing a lot of fundraising already as it is. Not even a couple weeks ago, we had the Bill Tillman Day. I don't know if you're familiar with it.
Yes.
And we had a booth set up and sold some T-shirts, hot dogs, hamburgers, and all sorts of stuff. We're also looking into getting help from other organizations, such as different grants, like from our rural fire coordinator for 80/20 REAP grant, all sorts of stuff to help us reach our goal of where we want to be.
Thank you.
Thank you.
Thank you, Chair.
Thank you, Representative Marshall. Questions for Austin from the committee? Questions for Austin from council on the line? Representative McHenry? Thank you. Austin, thank you.
Thank you.
Motion to approve.
Representative Jennings made a motion to approve the application for Cromwell Volunteer Fire Department. Second by Representative Marshall. Discussion. Any discussion? Hearing none, roll call vote.
James Jennings.
Yes.
Anna Marshall. Mary Crawford.
Yes.
Joyce Deere.
Yes.
Chairman, you got 4 in favor and 0 against.
4 in favor, 0 against. That motion passed. Austin, if you wouldn't mind, reach out to April Lindsay. Make sure all the information in your application is correct so she can get you taken care of.
All right. Thank you guys very much.
Yes, sir. Thank you. Next on the agenda, TR 21-112, a tribal resolution of the Muskogee Creek Nation authorizing Principal Chief to execute a memorandum of understanding between New Mexico Highlands University and the Muskogee Creek Nation. Sponsors, Representative Marshall. Representative Marshall made a motion for a due pass.
Second.
Second by Representative Jennings. Discussion. Representative Marshall.
We have Pete and to answer any questions.
Good afternoon, Mr. Koser.
Ms. Jay, good afternoon, counselors. I'm Pete Koser Jr. I'm the manager of higher education. This MOU began a couple years ago with a program graduate, Stephanie Camfield from New Mexico Highlands University's Master's in Social Work program. And the conversations have bridged out into some dialogue where we started having conversations with the university. And with the addition of this MOU, it provided another level of opportunities and resources for Creek citizens that live in New Mexico and Creek citizens living outside of New Mexico could have another option of higher education, but also be provided resources and opportunities. And additionally, we do have Dr. Spence Harrison, the tribal liaison from New Mexico Highlands University, on Zoom as we speak, so he can answer any questions in regards to the details of the MOU. I'm here to answer any questions as well.
Questions from the committee? Representative McHenry? Council on the line, questions? Representative Marshall?
Pete, who will be responsible for carrying out the responsibility of the memorandum of understanding at the college for Muskogee Creek Nation? Because I think you have someone named in here for New Mexico.
Right.
So who would be the one from Muskogee Creek
On
Nation?
our end,
Yes.
we would be collaborating with Ms. Willeen LaFall, our higher education director, as far as like selection of students. And, that goes into the student that would like to apply and become a part of the Highlands University system. But also, that's something that we would be happy to collaborate with. Our office works with over 1,500 students, approximately 1,100 undergraduates, and 2 times a year we have an open enrollment. So, and we do a lot of community outreach. So there's many times to vet potential candidates from Creek Nation to attend Highlands University.
Okay. Thank you, Pete. Thank you, Speaker.
But
Mr. Spencer, anything you would like to add?
No, just welcoming the agreement. Like Pete said, I'm the liaison for New Mexico Highlands University. On my end, I help out any way possible students to help them graduate.
Thank you, and thank you for being on the line today. Any other questions from council online or the committee? Thank you, Mr. Koser. Roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deere,
Yes.
James Jennings.
Yes.
Chairman, you got 4 in favor and 0 against.
4 in favor, 0 against. That motion passed. TR 21-113, a tribal resolution of the Muskogee Creek Nation authorizing Principal Chief to execute a certain agreement between the Muskogee Creek Nation Department of Health and Change Healthcare LLC. Sponsors Representative Crawford.
Motion for due pass.
Representative Crawford made a motion for due pass, seconded by Representative Marshall. Discussion. Representative Crawford.
I'd like to give time to Mr. Terry.
Thank you, Ms. Crawford, Chairman. Okay. This piece of software is a bolt-on to the new Epic software that we're building. It's a decision support platform that you would normally like to see inside the Epic package, but because our radiology system isn't part of Epic, this is going to be an add-on to that. I think it's about a $63,000 piece of software for us. I'll be happy to answer any questions.
Questions from the committee for Secretary Terry? Questions from council online for Secretary Terry? Representative McHenry? Thank you, Secretary Terry.
Thank you, sir.
Roll call vote, please.
Mary Crawford,
Yes.
Joyce Deer,
Yes.
James Jennings,
Yes.
Anna Marshall.
Yes.
Chairman, you got 4 in favor and 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda, NCA 21-072, a law of the Muscogee Creek Nation authorizing the expenditure of the Department of Health and Human Services Administration for Community Living American Rescue Plan for OAA Title VI Part C Native American Caregivers Funds for the benefit of the Muscogee Creek Nation Food Services Program, sponsored Representative Jennings.
Motion for a due pass.
Representative Jennings made a motion for a due pass. Second by Representative Marshall. Discussion. Representative Jennings.
Carmen.
Thank you, Mr. Jennings. Thank you, Chairman. I have Tammy from Food Services on the line, but this legislation is additional funding that we received for the American Rescue Plan, and the purchases will be for food and then the additional supplies to distribute it. And Tammy, if you have anything to add, or she can answer any questions too.
Ms. Ringo, do you have anything to add?
I don't have anything to add. It's pretty straightforward. It's just funds that were given to us by ACL from the American Rescue Plan as stated. So,
Thank you, Ms. Ringo. Question from the committee? Representative Marshall.
I have a question for Ms. Ringo or for Mrs. Carmen. On your direct assistance on your budget, you show that you have $45,340. How is this direct assistance going to be provided under this, under caregivers? Is there any specific,
direct assistance? Oh, I'm sorry.
Is there any specific things that you're going to be doing under that direct assistance?
That direct assistance is for respite care for the caregivers, and any supplies needed that we give to the caregivers. Does that answer your question?
Thank you, Ms. Ringo. Thank you, Representative Marshall. Any other questions from the committee? Council on the line. Thank you. Roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deer.
Yes.
Chairman, you got 4 in favor and 0 against.
4 in favor, 0 against. That motion passed. NCA 21-073, a law of the Muscogee Creek Nation authorizing the expenditure of the Department of Health and Human Services Administration for Community Living American Rescue Plan for OAA Title VI Part A and B Native American Food Funds for the benefit of the Muscogee Creek Nation Food Services Program, sponsors Representative Jennings.
Motion for a due pass.
Representative Jennings made a motion for a due pass. Second by Representative Marshall. Discussion. Representative Jennings.
Carmen.
This is also an additional award that we received as a part of the American Rescue Plan. And Tammy, if you want to add anything, but I know that the majority of this funding is for food purchases.
Ms. Ringgold, anything you would like to add?
Yeah, she's correct. Most of it's for food purchases, and then additional supplies needed for carryouts and things like that when needed.
Thank you. Questions from the committee? Representative Crawford.
Ms. Carmen, are you all still delivering meals to the homebound citizens?
We are still doing homebound meals, yes.
And is that out of every nutrition site?
To my knowledge, yes. I'm not sure about Coweta, though.
Mm-hmm.
Tammy, I don't know if you have information on that.
That I personally don't know. I'd have to ask Anna. She
Okay.
would know more than me.
To my knowledge, we are doing it from the majority. It seems like Coweta may be one of the places that they haven't set that up yet, though.
Okay. Is there anything that the citizens that become homebound, how do they go about receiving meals?
So they can contact the Elderly Nutrition Program and just let them know that they are interested, and they'll do an application and determine if they're eligible for the homebound program.
Okay. But the people that deliver the meals, they are the only ones that can deliver meals. Is that correct? Or can family members or like a provider come in and pick up a meal for a citizen?
It's my understanding that yes, that it would just be the elderly nutrition staff that could deliver the meals.
Okay. All right. Thank you.
Thank you, Representative Crawford. Any questions from council on the line? Hearing none, roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deer.
Yes.
Chairman, you got 4 in favor and 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda, NCA 21-088, a law of the Muscogee Creek Nation authorizing the expenditure of grant funds awarded from the Institute of Museum and Library Services for the benefit of the College of the Muscogee Nation. Sponsors Representative Jennings.
Motion for due pass.
Representative Jennings made a motion for a due pass. Second by Representative Marshall. Discussion. Representative Jennings.
Dr. Randall.
Ms. J, thank you for your time. This is just an annual grant that the nation receives, and it's usually alternates between us and the Cultural Preservation Library. So this year we're receiving it. So I think we have scheduled the expenditure for databases for our library, databases that we operate. And we also have Mrs. Karen Hott, our librarian. She's on the Zoom meeting, so she can answer any questions as well.
Thank you, Representative Jennings. Questions for President Randall from the committee? Council on the line? Representative McHenry? Ms. Hawks, was there anything you would like to add?
Appreciate your time.
Thank you. President Randall, thank you. Roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deer.
Yes.
Chairman, you got 4 in favor and 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda, NCA 21-089. A law of the Muscogee Creek Nation authorizing a budget modification in excess of 10% for the Muscogee Creek Nation Department of Health Facilities Management third-party budget for FY 2021. Sponsors Representative Deer.
Chairman, I motion due pass with the amended amount.
Representative Deer made a motion for due pass with the amended amount. Seconded by Representative Crawford. Discussion. Representative Deer.
Yes, sir. Mr. Terry, would you like to explain this amendment?
Thank you, Ms. Deer. This was a last-minute amendment that got sent a couple hours ago. Chairman, we apologize for the confusion. The original budget modification that was over 10% was due to the construction cost on the new behavioral health building drastically increased from our original estimate last year. And so we made an internal modification to adjust for those costs. And then also just a couple of days ago, we got the quote for our liability insurance policy, and it was $300,000 over last year. So we included that amount. And I think Janetta sent that maybe 30 or 40 minutes ago. And April. So I need to get that. Let me see if I can figure out where that went to. Give me just 2 seconds here. I think it went around noontime, April. So I apologize if that didn't make it in, but there's a.
What's in the report? Would be Childers Architect. Oh, okay.
Secretary Terry, would that be the $309,297?
Yes, sir.
Thank you.
Yeah. The bottom line of the account doesn't change. It stays at 6.258 million, and we don't change that bottom line. It's just really moving some money between those accounts.
Secretary Terry,
Sir,
will you please, after the meeting, when the opportunity presents itself, will you send us a updated budget, please?
we will.
Thank you. Questions from the committee? Questions from council online for Secretary Terry? Hearing none. Roll call vote, please.
Joyce Deere,
Yes.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford.
Yes.
Chairman, you got 4 in favor and 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda will be other business. Discussion, Department of Health update. Secretary of Health, Mr. Terry.
Thank you, Chairman. I have a lot to talk about today, and I'm going to go back between my phone and my iPad a little bit, so forgive me for being distracted between all of these devices. Like to start out by talking about some of the nature of the COVID pandemic that's out there right now. Today, the Muscogee Creek Nation, we're at about a 20% positivity rate. Our hospitals are overflowing. And if I had to say that if any question is going to come to you guys as far as complaints go, you're going to hear, why are our citizens being sent out of state? And today, the closest hospital that we have to transfer a patient to is Albuquerque, New Mexico, if we're in trouble. So it is a dire situation for hospital capacity in Oklahoma right now, and that's where things stand at this time. For last month, the Department of Health, we continued to advance the development of the electronic medical record in Epic. We're still on pace to complete that design in February of 22 as expected. last month, we attended most of the elderly nutrition sites to give updates on the new Council Oak facility and also to talk about the importance of this vaccine. And I'm going to try to switch over to a document from the CDC that came out today that talked about among adults aged 65 to 74 years of age, the effectiveness of full vaccination for preventing hospitalization was 96% for Pfizer, and 96% for Moderna, and 84% for Janssen. Among ages over the age of 75 years old, the effectiveness of full vaccination for preventing hospitalization was 91% for Pfizer, 96% for Moderna, and 85% for Janssen. So I can't really stress enough, we want to say it in every forum that we can say it. We've been saying it every community meeting. We've been going to schools. We need our people to be vaccinated. We can prevent these hospitalizations. We can prevent people dying at over a 90% rate if they will get this vaccine. It's very, very effective, and we need to keep preaching it everywhere we go. That really needs to be the message every time that we have anything. Get this vaccine. It's going to keep you out of the hospital, and it's going to keep you from dying. Over 90%. The construction of the new behavioral health building is on schedule. If you look in the electronic package that we sent earlier, we gave you pictures. The steel package is up and going, and you'll be able to see the improvements that has been happening there. We hosted a naming ceremony for the former Cancer Treatment Centers of America building in Tulsa, and the new name of that, as you now know, is the Council Oak Comprehensive Healthcare. We're excited. We opened the doors last week. We made an announcement that we started seeing urgent care patients. I think yesterday we saw over 20 patients in our urgent care. Dr. Reed has been very effective in her clinic up there, so we're real excited. We have some basic x-ray up and going, pharmacy up and going there. So little by little, we're really getting that building up to speed, and we're excited about that. We hosted a reception for Dr. Casey Schrum last month. She is the new president of Oklahoma State University, and Dr. Schrum, she grew up in Coweta, and she's been an advocate for tribal and rural health care for many years, and we were very honored to have her come and let us recognize her for her accomplishments, and we hope that that's going to continue to strengthen our relationship with OSU in the future. The clinic operations, the Eufaula clinic staff has been working with the Eufaula dormitory and the local schools to offer COVID vaccinations to anyone interested. They have attended a number of local meetings and community centers and lunches to try to get out to as many folks as they can. And that's really the story of what our entire clinic operations has been in the last month. We've been trying to build back in-person volumes that was previously seen during the telemedicine with pandemic. And now that it's spiking back up again, we're probably going to start to see some of those telemedicine visits coming back into play. One of the things that you're probably going to be hearing complaints about when it comes to the clinics is really the dental visits has been taking a hard hit during the last year with the pandemic, and we're trying to discuss alternatives inside the department right now to see if we can try to find a way to get people their dental exam and cleaning, and maybe we may have to end up looking at contracting some of that out and going to the private sector and doing more. I think it's going to take us a long time to get caught up after this last year, so we are looking for alternatives. In the hospital operations, the medical center and the community hospital are focused on managing the pandemic volumes. The emergency room addition at the medical center, that design is complete. It's in engineering, and hopefully we're going to have a package to get ready to bid out for construction in the very near future. And then the medical center held a ribbon cutting for the newly remodeled hospital rooms on the second floor. As we all embarrassingly know, I failed to get that invitation to the council in the appropriate time. So once again, I'm going to ask for your forgiveness for that. But in our quality and public health arena, the COVID-19 recovery plan has been updated to reflect all the changes and the reimplementation of our mitigation efforts. They're working really hard at just at all of our community events and really making sure that these events are coming off as safe for the COVID mitigation as they possibly can. Our public health nurses are out in the community assisting in schools and communities. We've been in Jinx, I know, recently, and we've done several hundred vaccines up there. The Special Diabetes Program was awarded, the Muskogee Nation was awarded $250,000 for a one-time grant supplement there. So we're glad that they're able to keep that program financed for another year. When you get into the finance, the total collections for the month of June, we brought in about $7.7 million last month. That's still very strong. As of this time last year, we were in the black about $36 million, and this year we're at $53.3 million. So finance is still very, very strong. Our refill center has really been what has made the difference in that, and we're just really doing extremely well. And we hope that we continue just to keep improving that year over year. As I mentioned earlier, you're going to have in your packet the total amount of cases. The 7-day increase that we've had has been, over 4,000 across the Muskogee Creek Nation tribal jurisdiction, and it's really just been a pretty grim situation. And then, of course, I always throw a few stats in there to bore you with in the end. But with that, Chairman, that's my report. I'm happy to answer any questions.
Thank you, Secretary Terry. Representative McHenry.
Thank you. I would like to ask, you was talking about the COVID and the spike in it. In this situation, how far away are we from actually really scaling back, if not shutting things down from community centers, from gatherings, from forums, and all the things that are taking place right now?
Yeah, so thank you for that question. That's a topic that the chief of staff, myself, that we have almost on a daily basis. We've been watching these numbers. One of the things that we're really trying to be mindful of is that when you look at the most vaccinated population in our nation is that over 65 population. So with that protection of that vaccine, we know that they're very safe. We haven't had any discussion yet about trying to shut down communities at that level again. I know that was very hard on those communities. We have, however, started looking at the nation offices, and if we need to close down the lobbies, and that may be something potentially that's coming in the near future, is shutting the lobbies down again and going to some appointment only type of services. If you are unvaccinated, over on the tribal side, it is required that you wear a mask from the time you show up and any time that you're in one of our buildings. So that has been something that they have become a stickler on. So I wish that I had a great answer for you. I don't think that at this time we're ready to make that call to just shut down again, though.
Thank you, Representative McHenry. Representative Jennings.
So, Mr. Terry, we're not going to wait till the state of Oklahoma declares emergency, are we?
No, sir. I don't. I think that one of the things that we saw in early on in the last pandemic, that I think that being at work at Creek Nation might have been one of the safest places you could be. Our rooms, our offices are very clean. We distance, we use all the proper things, and people are safe in these buildings. We clean the buildings, we use the right air filtration, we do that. So we believe that people are probably safer being right here at work than they are anywhere else. And as I have as I made mention to the council a couple of weeks ago, that we have now mandated the vaccine inside the Department of Health, and that as that continues to take place, we think that we're hoping we don't have to go back to that state of emergency again.
One other thing. So, there's a greater number of Native Americans that are vaccinated in the state of Oklahoma than opposed to the rest of the population, correct?
I would say so. I think that the tribal nations have done a fantastic job in the state of Oklahoma. I think we led the way. I think that if the state of Oklahoma hadn't had the tribal nations, it wouldn't have anywhere close to the number of vaccinations that it's rolled out. So overall, comparably, I feel really good about our elderly population over the age of 65. I'm going to, and please don't hold me to these as hard numbers, because I don't have hard numbers, but I think that we're probably upwards of 80% of our elderly that's vaccinated that is out there. I think that number drops down in probably the 40s or 50s when you get it. Maybe 50 and older, and then when you get below that, we're probably in the 30% or older. But we've done I think that we've done a really good job, and I can tell you this for sure: anybody that wants a vaccine, they don't have to wait on us. We will vaccinate anybody at any time. So,
thank you, sir. Thank you, Chairman.
Thank you, Representative Jennings. Questions for Secretary Terry? Council on the line.
Chairman, this is Thomasine.
Representative Joel Osborne.
Yeah, Mr. Terry, early on in your report, you'd mentioned that the statistics that prevent our elderly getting the COVID again. Are you sharing those statistics whenever you or your staff go out? Because I know when you mentioned that with those numbers, that really hit me hard.
The actual document that I was referring to, Ms. Osborne, was a new CDC document that came out that I received at 11:50 this morning. So I haven't taken that into public yet. So the specific numbers that I gave today, I am going to release that out on our website and out on social media this afternoon. But I get your point. I'm with you. It's pretty astounding.
Thank you. And the next question I have is, those employees that we have, whether they're with health or they work for the nation, or even gaming, it doesn't matter. If they are not vaccinated, are they going to be losing their job?
The Department of Health is the only department within the nation that is requiring the vaccine. And yes, it will be a condition of employment for Department of Health employees. That discussion has not started happening inside the tribal offices or in the gaming offices, as far as I know. I've never heard that discussed, but you're starting to see healthcare organizations across the state and across the country start to mandate this vaccine.
Thank you. Thank you, Chairman.
Thank you, Representative Yohola Osborne. Questions from council on the line for Secretary Terry? Secretary Terry, board's back to you.
Thank you, Chairman. That's all I have. Thank you.
Thank you, Secretary Terry. Next item on the agenda will be announcements. We have any announcements from the committee? Any announcements from council on the line? Hearing none, entertain a motion to adjourn.
So moved.
Representative Marshall made a motion to adjourn, seconded by Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deer,
Yes.
James Jennings.
Yes.
Chairman, you got 4 in favor and 0 against.
This time I'd like to ask Representative Crawford to please give the benediction. Amen. Meeting adjourned.